Okay, so hi everybody. It's Jackie Boyle speaking, and welcome to this week's call with Dr. Joseph Ahrens and his brand. And today's topic is about arthritis and rheumatoid arthritis. And I'd like to say from the beginning, I've got a very special guest and a very good friend of mine, Dean Kilby, that is going to be presenting for us today. Dr. Ahrens would like to apologise because he's had some family commitments that have just been unavoidable for him that he couldn't make today, but he will be back next week, and I'll tell you what the topic is going to be next week at the end of the call. But welcome, first of all, Dean. How are you?
I'm well. Thanks for having me. It's great to be here.
We are very excited to have you here. What I want to do, everybody, is just to share to you why Dean is so important and why we have actually asked him as a special guest to come on board. So for those of you that do watch this call at a later date, I just want to share with you Dean's background. So Dean Kilby has a Bachelor of Science in Honours in Biotech, and he is a founder and director of his own company called Simple Health. His education in biochemistry and microbiology. He's educated in those fields, then graduated with a first-class honours in biotechnology and undertook a subsequent postgraduate training in molecular medicine. Molecular medicine, sorry, Dean. His scientific and clinical experience has since spanned the pharmaceutical industry, medical communication and scientific consulting, from metabolic disease to regenerative medicine, both in Australia and internationally. Further to this, Dean has extensive experience in transformational performance coaching and has been a leading trainer across the ANZ region for almost 15 years. He founded Simple Health, and with a commitment to contribute the possibility of being well to big people with big lives. Not only I've seen this firsthand with Dean, I've experienced what he does, and I know that what he does deliver and he offers is something like I've never experienced before, and it simply works. But also with Dean, he's got a team of advisors underneath him. So I wanted to explain this to you, that he comes with a lot of credibility. This man knows his stuff, and this is why Dr. Ahrens was very elated and very proud to be able to have him fill in for him, because he knows that Dean comes with a lot of expertise, and these are the team of advisors that he has underneath him. There's some pretty phenomenal doctors with a lot of knowledge, a lot of global knowledge underneath them. And I sit back, this is actually my husband, so I'm pretty proud of this one, that he's involved with Dean as well. So when we start looking through at the team of advisors that Dean has, that he has surrounded himself with, these are only just a few. So it is quite remarkable in regards to what Dean does have to offer and what he can bring to the table. So this is why I'm excited to actually welcome you, Dean, to start and talk about arthritis. So if we can start into that space, if you can start and tell us a little bit about you, if there's anything else you'd like to add to it, but otherwise we will get started into the topic of arthritis and how it affects the body in the inflammatory markers. And if we can start off in osteoarthritis, if you can share with us your thoughts and what we can do with this condition.
Sure. I mean, it was a pretty comprehensive introduction, so thanks for that, Jackie. It was great to meet Dr. Ahrens when he was here in Australia, and get along with him really, really well. I love what he does and what he stands for, so it's a privilege to be here involved in this capacity. Simpler Health is simpler is actually an acronym. So it stands for the science of immunometabolic protection, longevity, and regeneration. So I have involvement in metabolic disease, and primarily dealing with people with metabolic syndrome and reversing that. But as you just alluded to, inflammation and inflammaging, more specifically, seems to have the biggest impact on the health span for people in Western cultures in particular. So that inflammation can cause degenerative disorders. It seems that tissue doesn't regenerate properly in a background context of low-grade chronic inflammation, and that in our society especially so in Australia and the US, is primarily driven by excess belly fat. I mean, 2/3 of the adult population seem to be at least overweight. Half of that cohort are obese, and the statistics are similar both here in Australia and the US. So that belly fat tends to drive up inflammation, the inflammatory response. So that then, of course, inhibits or constrains the regenerative process. So if you look at osteoarthritis, which is a degenerative joint disorder where there is a diminution of cartilage in the joint, then what happens is in all your tissues, you've got regenerative processes. So you have tissue degeneration and also tissue regeneration, and this is what keeps it net neutral. But in a background context of inflammation and injury and aging, then what happens is the regeneration, that process doesn't happen as well or as effectively. So the net effect over time is one of tissue degeneration. How you experience this clinically is as you're getting older, your joints just start hurting. They're stiff. You wake up in the morning, it's hard to get out of bed. It takes a little bit to get them going. You've got to warm your joints up. It might be a lot of soreness after a walk or bouts of exertion. And if you look at this radiographically, so on an X-ray, for example, or MRI, you'll see a decrease in the joint space, and that would get diagnosed as osteoarthritis. So what are the predictors of that, or what influences the onset of osteoarthritis? Age is a major risk factor. Gender as well. So women typically experience or are more diagnosed with osteoarthritis compared to men. But also the, age and gender, you can't do much about. Obesity, however, is a major risk factor, and that you can do something about. So regulating your hormones, regulating your metabolic control, your glucose metabolism can have a major impact on preventing the onset of osteoarthritis and also decreasing the symptoms experienced when one already has the onset of osteoarthritis. So that's a little bit about OA. Anything further?
Well, I'd like to ask you, why is it, in your opinion, that osteoarthritis is more common in women? When we're looking at the ratio between men and women, can you explain to us as to why women are more prone to osteoarthritis than what men are?
Yeah, I mean, there's hormonal differences, obviously. There's fluctuations with women with the hormones. Men's hormones are pretty much like this. The impact, however, seems to be greater in men. Maybe we complain more. maybe we suffer more. Women just get on with it. And but across the board, the biggest risk factor, however, would have to be age and obesity, the onset of metabolic syndrome.
Okay. So when we're looking at metabolic syndrome, like in the effects on how it can come back to add to the symptoms of somebody that's suffering with osteoarthritis, when we're talking about changing our diet and we go down that pathway, what are we actually looking at? So we may, let's delve into that space, because I think it's good for people to understand if you are diagnosed with osteoarthritis, what can we do? Like, we know that we are looking at products like Emulin to help in regards to assisting the symptoms of the not the symptoms, but the level of the inflammatory levels. But when we're looking at our foods, just briefly, like key foods that we actually should be avoiding, are there particular ones that really raise the flag for you in, the top 5 or 6 that you would say, well, try and steer clear of these? I know there's a multitude of them, but I know that would be, a top half a dozen of them to steer clear of, Dean.
Yeah, so I think if you go back to what I said about inflammation, so what really drives inflammation for the majority of people is excess insulin. So that's the root cause of metabolic syndrome, and that state of metabolic derangement that many people find themselves in. It's a hormonal imbalance, and as I said, primarily driven by excess secretion of insulin from the pancreas. So what causes secretion of insulin from the pancreas? If you eat too much sugar. So here in Australia, for example, on average, the average adult would consume about 42 kilograms of sugar every year. So this is a massive amount of sugar to be consuming. So sugar is inflammatory for a couple of reasons. One is it spikes insulin. Insulin is pro-inflammatory. So if you're eating dessert all through the day, and if you look at the kind of the standard Australian diet or standard American diet, in other words, SAD, it's just carbohydrates and refined carbohydrates throughout the day, breakfast, morning tea, lunch, afternoon tea, dinner, snacks in the evening. It all adds up. And your insulin levels never really get a chance to come down properly. So that it'll be on the decline, you'll eat again. So that constant feasting throughout the day, and in particular, carbohydrate-rich foods, that especially sugar, and in particular when it's combined with fat, it tends to wreak havoc on our pancreas. So these are foods that we all get addicted to, chocolate, even deep fried potato, croissants, cheese on bread, etc. So wherever there's a combination of fat and carbs, if you overconsume that, it's going to be really deleterious to your body. So there's the insulin effect, but then there's also this phenomenon that we call glycation. So if you just take glucose and protein in solution and put them together, the glucose will stick to the protein. And that's a process that we call glycation. You end up with what we call advanced glycation end products. So that's an acronym we call AGE. So these AGE products then bind to receptors on the surface of our cells. We call these receptors for advanced glycation end products, or in other words, RAGE. So when AGE binds to RAGE, it sets off a cascade of biochemical events that results in tissue degradation, inflammation, and accelerated aging. So you really don't want to overconsume sugar. So that's a big one. And then other foods that drive inflammation are probably the two most common causes of dietary inflammation are grains and dairy. So if you limit grains and dairy, that can have, and sugar, that can have a massive impact on decreasing the risk of metabolic syndrome, somewhat even reversing the symptoms that you may already have. But the key with osteoarthritis is you don't want the tissue to degenerate in the first place. So you want to handle that before it gets to the point where you're immobile, your joint mobility isn't so great, and your quality of life is suffering.
So it really is, I mean, I know that genetics do play a little bit of a role in that area, and that is something that can happen, but we certainly can take some steps to assist our body and support it for it to not to progress to where it is degenerating, as to what you've said, Dean. So there's a lot of really great information in there in osteoarthritis. So if we step into rheumatoid arthritis, and again, it's an inflammatory based condition as well, but rheumatoid arthritis, I believe, and I might be wrong, and this is why you're on here, to be able to provide the expertise here. It is a condition that it attacks its own joints. So, and it can be really debilitating for a lot of people. So would you like to share your thoughts in regards to rheumatoid arthritis, Dean?
Yeah, so rheumatoid arthritis, as you said, it's an autoimmune condition. So it's one in which the body starts, your own immune system starts attacking certain tissues. So this can be brought about for many reasons. You know, there may be a genetic predisposition, there may be a viral infection, there may be some issues around intestinal dysbiosis, so gut health issues that can exacerbate or stimulate the onset of these autoimmune reactions. But essentially, the immune system starts attacking the cartilage in the joint, and you know it's horrible. And this can start at a very young age Similar to type 1 diabetes, you know, this is can be for pediatric patients all throughout life, and it can be quite debilitating. So, you know, people experience achy joint flare-ups that are just horrible. And, you know, the mainstay medication for these types of conditions is steroids, just to help dampen that immune attack. But that can also lead to other issues. There's side effects to those medications as well. So what we find is if people regulate their nutritional environment and they keep inflammatory processes as low as possible, a lot of the hyperimmune response in that auto attack gets dampened. So the symptoms are significantly lessened. We can't say that there's a cure for it, but if we can modulate those symptoms to a point where the patient has a better quality of life, then it's a big deal for those people who suffer from those types of diseases. Absolutely.
So again, I mean, I've had family members that have been involved, and we're not making any claims here either for any that we're curing, healing, or fixing anything. And we're not experts in certain places as well. But Dean, we know that from children through to adults, arthritis is a disease that can affect children right through to adults. So it's really important to understand what we fuel our bodies with. But I'd like to even touch base with you in regards to the, you know, the flavonols that we just simply aren't getting out of our food like we were getting 20 and 30 years ago. Do you have any thoughts in that in regards to how we can, I know we've touched base on you know, foods that we should be having, but when we are specifically talking about flavonols and how important that they are in the system, is there anything that you'd like to add in that area, that the importance of being able to supplement what we're not getting that's going to assist us in the symptoms of osteoarthritis and also rheumatoid arthritis?
Yeah, I mean, these plant-derived molecules are fascinating. You know, we co-evolved with plants. So that co-evolution process, we developed receptors for these types of molecules. They have profound effects intracellularly as well in terms of modulating gene expression. There's a whole field in science called nutrigenomics. So that's how certain nutrients and molecules, especially derived from plants, can modulate how our genes are expressed and influence our aging process. So, you know, I think they're incredibly important. They have some profound effects on, again, reducing inflammation. So there's a number of anti-inflammatory effects that have been well documented in the scientific literature around flavonoids. And then there's also immunomodulatory effects of these types of molecules as well. So how they can better support the immune system and even help regulate T helper cells. And sometimes the T helper cells get a little bit crazy. Either they underperform or overperform. You end up with, you know, even hypersensitivity in certain situations as well. So, you know, some of these molecules, they're showing that they even have neurogenic effects. So they can stimulate the formation of new brain cells and nerve cells. So, you know, I think they're incredibly important, and people just aren't eating the volume of plant matter that we probably ought to be. If you think about the total caloric intake, say if the average person's consuming about 2,200 calories, a lot of those calories are taken up by empty food groups, you know, like the refined carbohydrates, like too much saturated fat, etc. So these types of food groups are just so abundant. You just got to go out into your environment. There's bad food choices everywhere. So it's really difficult for people to kind of get the required amount of vegetable matter in their diet and regulate their weight. So that seems to be, you know, a big concern for a lot of people, is how much they weigh, and they try and focus on their total body mass. But you've got to increase the volume of vegetable matter to get those types of fruits and vegetables, to get those types of molecules into your system. So yeah, supplementing would make, you know, for many people, it makes a huge difference. Absolutely.
So, Dean, also just the last question that I really want to ask, and to try and fit this together for people to understand the benefits of this, is there's also body movement. So if we're looking at exercise, you know, if we try to, I know through my years of where I've been and the space that I have a lot of experience in, mobility is one of those within the fitness industry and rehabilitation, which is where my husband is an expert as well. But in your opinion, getting people mobile, what are the benefits in regards when we're talking about osteoarthritis, like having a decent diet, monitoring what we're doing within our food choices, but how can exercise and getting mobile help a person that actually has osteoarthritis or also rheumatoid arthritis?
Hmm. Well, you got to deal with it on a couple of fronts. So firstly, I would focus primarily biochemically, and be responsible for the nutrition that you're getting, and be responsible for the stuff you're putting in your face that's poisoning your body as well. So you want to handle that. I think more importantly than anything, you got to put the fire out. You know, we had bushfires not that long ago here in Australia. What's the first thing you got to do is you got to put the fire out. So if you're hyperinsulinemic, you got to put that fire out. You got to stop the inflammation as much as you can. Once the fire's out, you also have to be cognizant of regeneration. So these types of molecules, like these plant-derived, you know, quercetin, for example, has anti-senolytic effects. What does that mean? As we age and as we accumulate these advanced glycation end products, that can contribute to the increased number of senescent cells. So these are cells that they're still around. They're not functional though. They're not doing the job that they ought to be doing. They're just hanging around. It's kind of like they go into early retirement. And then these cells, just like when human beings go into early retirement, maybe they turn into old grumpy bastards and they complain a lot. And what these cells do is they complain. They do that in the form of inflammatory molecules that they secrete. So there's the secretory process then recruits other cells to become senescent as well. Ordinarily, what would happen is your immune system would clear those cells from your body. But given the Western diet, you know, that we consume, our immune systems are also suppressed. So we have this, you know, further accumulation of senescent cells and further exacerbation of inflammation. So that all further leads to tissue degradation. So you want to make sure that you've got plenty of these molecules in your system, like quercetin and some of these other polyphenol antioxidants as well, that help to clear those senescent cells. And then you want to empower your regenerative process. You want to make sure that your mesenchymal stem cells that can regenerate the cartilage, for example, your body has maximum opportunity to do that. Now, you got to remember that this isn't just a biochemical disease. Osteoarthritis is often brought about because there's an originating trauma to the joint. So joints aren't just bones and cartilage. You also have ligaments that wrap around the joint like rubber bands to kind of hold the joint in place. And if you have a trauma, it causes ligament laxity. It's like when rubber bands lose their elasticity. And then you have an unstable joint. And if you're trying to move and function throughout the day, the instability in that joint means that the biomechanical plane of the movement of that joint doesn't happen as it's designed to do. So then you get further wear and tear on the cartilage because the joint's not moving properly. Now, if the joint's not moving properly, it's unstable. You have other muscles that need to step up a gear and overcompensate. So then you end up with trigger points in those muscles. So you've got muscle striations like this and it contracts. If they're overloaded when ordinarily they shouldn't be working so hard, you end up with knots or trigger points in those muscles. That then shortens the muscle belly and it can put a lot of stress on the insertion sites. So you get micro tears that causes more pain. So, you know, then it's not just about that joint. There's other contextual joints that work in concert with that joint for you to function and move appropriately as a human being. So, you know, it can be, you can have osteoarthritis in your ankle and you end up with really bad back pain because of it, you know? So if you move your stem cells that contribute to the regenerative process and the healing process of improving tensegrity, so tension integrity in your ligaments, cartilage regeneration, all this sort of stuff, that needs to be stimulated by movement. So we know in the laboratory, for example, if you take stem cells, so these are undifferentiated cells, they're kind of like a new baby. When you look at a baby, you think, you know, when I held my children for the first time, I looked at them and I thought, wow, anything's possible for them, right? And that's what it's like for a stem cell, where they could turn into different types of specialized cells. Now, if you get these types of stem cells in the laboratory and just flow fluid over them, they could, that mechanical movement of the fluid over the stem cells can stimulate them to become the kind of cells that line the lumen of your blood vessels. So stem cells respond to mechanical influences. And, you know, I used to own MSK Stem Cell Clinic, which was an advanced regenerative medicine clinic here in Sydney. And we would inject stem cells into the patient's osteoarthritic joints and would rest them for a couple of weeks, but then I'd encourage them to resume normal activity. And the mechanical movement and stress would signal to those stem cells to start turning into the chondrocytes that they need to be to help improve the cartilage lesion that comes about from osteoarthritis. So yeah, absolutely, movement is critical. You know, obviously people, once you start feeling better though, and the pain is no longer as bad as it was, you got to be careful not to over, you know, stress it. Don't be doing anything silly. Don't think, oh yeah, I feel like 10 years younger, I can go for a run now. You've got to ease up to that, because the supporting soft tissue, the ligaments and the muscles aren't as conditioned as they once were, because you've been injured with the osteoarthritic lesion. So, you know, people need to be responsible for that. They should seek professional help and get the guidance that they need.
Look, Dane, you know, personally for me, and as I as I talk about this and I listen to you speak, and knowing you, you know, you are just an encyclopedia of knowledge, and that's showing my age, because an encyclopedia is something that we just don't see. So you are a Google of knowledge when you go out there and you search now on the Google engine, because there's not too much that you do not know about. If I ask you a question, you can give me the answer when it comes to health and well-being. And if we look at, to finish this conversation off in this topic today, it's really evident to myself over the years in seeing family members suffer with osteoarthritis. My mother does, my father has rheumatoid arthritis. I've had a nephew from a young age as a 1-year-old, and he eventually outgrew the arthritic conditions as a child suffering with arthritis. But the one thing that came through with it, besides it being a genetic condition that some people are born with, it does come through trauma. But if we can manage the inflammatory levels within the body, it can certainly help to assist in managing the symptoms that come with it. And for nearly 4 years, I've been involved with Emulin, because that's the space where we're in on this call, where people are understanding the power of what Emulin can be for people and how it can support them because of those active ingredients with quercetin, myristotin and chlorogenic acid. They all work towards being able to assist the body in lowering the inflammatory levels. However, you do need to make sure that you are actually looking after your own body and be responsible by what you're fueling your body with, and also by getting yourself moving as well. So look, I want to really thank you, Dean, because I know that when we bring you back on to another call down the track, we've only just touched the surface. Because for those, again, that are watching this now and that watch this later on, I went through protocol with Dean in December last year, and I thought I had a reasonably clean diet, and which I think I did. But I learnt so much by taking out specific foods out of my body, and my body responded within a matter of a week. I wasn't happy for the first week, I must admit. Kept on taking my Emulin, but by changing those food choices and taking out things that I was just sneakily just putting in there, taking them out made a massive increase to my body. But within that 4-week period leading into Christmas, you can imagine it wasn't easy with the Christmas parties, etc. I surprisingly lost about 4 kilos, and I didn't think I had 4 kilos to lose, but it dropped. And it was just through my food choices. But what I found was that the symptoms that I'm normally experiencing lessened as well, because I had Emulin on board, but I changed what I was eating and eliminated foods that were fueling inflammation that I was unaware of through Dean helping me and Dr. Ahrens' expertise as well. I became certainly a lot healthier, and it's made me more aware over the last 12 months. So I want to thank you so much, Dean, for joining us today on this call. And hopefully, if you've got any questions, please make sure you reach out to us through info@drjosephahrens.com. And hopefully have a great day. And thank you, Dean. Is there anything that you'd like to add to this before we finish?
No, it's my absolute pleasure. Just really appreciate the opportunity to share and contribute. And, it's an important topic. Pretty much everyone over 40 is dealing with some level of osteoarthritis. So, it needs to be handled responsibly, appropriately, and with a sense of maturity. So, I appreciate being able to contribute, like I said. Thanks.
Yeah.
Thanks again,
Thank
Jackie.
you. So next week, as I said, please, Dr. Ahrens really wanted to apologise because it was really unavoidable for him today. Next week, we are going to delve into, the topic's going to be on 24/7, the product itself, and understanding that particular product, because we do have a lot to talk about always on Emulin, but I spoke to him earlier today, so we are going to talk about 24/7 and exactly what that product is and why why it is effective and how it works and how it functions and how it can assist everybody. So thank you, everybody. I will finish the recording. I want to thank you so much for joining us. Please stay on. I've got another announcement I just wanted to make with you, but thank you so much, Dean.